Hi all, this is Dr. Ajila here. The first time that you're going to see me in this location, and I'm also pretty excited because I thought, as I'm always giving you this information about moving to Dubai or your career journey, and I thought, why not take it to a different level? Yes, it's happening, a new series where I'm going to bring in renowned persons and talk about their career journey. As I was a young teenager, I had so much of confusion regarding my career pathway and how to follow it, and a lot of confusions. So I thought, why not clear it out for you guys out there? Because nobody was there to tell us you need to choose a pathway that will align to all perspectives of life or all that you are. I mean, nobody told us that. Let's open our eyes and see people, how they took each step, and that can help all of you to attain your goals. So, yeah, here it is. So, in this first episode, I'm going to bring in one of my friend plus a doctor who is a dental doctor who opened his own clinic in Dubai. So, today we have Dr. Shajahan here, and Dr. Shajahan is the sole owner of Smile Essential Dental Clinic, which is located in a very prime location, that is Karama. Welcome, Dr. Shajahan.
Thank you, Ajila.
I'm so glad that you're my first guest. Dr. Shajahan moved to Dubai in which year? Please tell us about your journey.
I moved into Dubai like 11 years back in 2014. Then I came to Dubai after some job hunting, like everybody does. I took my CVs and went to multiple places.
Okay, you went to places
Yes.
and dropped your CV.
course.
Did that help?
Of course, like I got calls from that time. It was not that saturated like you see it nowadays. That time it was difficult to find a job. So I remember like my cousin used to drop me in Jumeirah one side in the scorching sun. I used to go to each and every clinic and go to the reception and give my CV.
Yes.
Like that was like when I think back.
I know.
It was a bit
People
difficult.
might think that coming to Dubai and getting a job is easy, but the struggle is real, guys. All of us have gone through that. Yes. Yeah.
So initially, then at some point, I got frustrated also, like because I had a clinic back home which was established.
Okay, so you had a clinic back in India and you were working well off there, and then you decided to move to Dubai.
Yes, I wanted to have a better life. Like
Okay, so the standard of living was
exactly.
the reason. Okay.
So it was not that like I finished my schooling and I worked in couple of clinics with some senior doctors to get good amount of knowledge. That is very important. And then I started my own practice. Then I had it for almost 2 years. Once I like decided, my friends, family, most of the people are in Dubai. So that is how everyone comes to Dubai.
Yes.
Because when you see people...
Mini home, mini South India, in fact.
Yes, when
Yeah.
you see people standing in front of Burj Khalifa and clicking photos and posting in Facebook.
Then did you work in Dubai, or you straight away started your clinic? How was that?
No, I came to Dubai. I joined in a place. That was a newly opened place.
Okay.
It was not so great. My initial experience was really bad.
Bad. How is it for a dental doctor to come to Dubai? What are their expectations, and how is the journey going to be?
I got couple of offers. So initially I got 2 offers after like 1.5 month of searching job. So my initially what I decided was like I will search for 1.5 months like that. If I didn't get any openings, I'll go back and sit in my clinic.
Yeah, you had that choice.
Yeah, I was mentally prepared like that. So the end days.
So you could take that chance.
Exactly.
That is also one thing very important.
So those new people who are coming, always I tell them, don't get demotivated when somebody like rejects you or when you're not getting a job or anything. You always have an option to work somewhere. Working is important. Gain more experience. When you gain a lot of experience, then you get the confidence. So wherever you go, you prove yourself. Like you work and show that you can work.
But the thing is that when initially, even what I have also felt is that when I came to Dubai, everybody was desperate to get a job because we are taking so much of pain, spending so much of money and keeping a lot of hopes. And when you come, you were so much in desperation that you tend to take up anything and everything that you get. And I think in that way, many doctors are exploited, or they are taken up for lower salaries or things like that. What do you have to say about that?
Now I'm a doctor and an entrepreneur.
Yes. So you know both the sides, right?
Yes.
Yeah.
So as I have to tell the new kids, the new generation people, the Z or what?
Gen Z.
Gen Z, yeah. So you have to show some patience, really good patience. no doctor in the world, if it is Ajila
Yes.
or like Dr. Shajahan or anybody else,
yeah.
initial days will be depressed till you set up a good, you get a,
Reputation.
yeah, it is a bit because we are not coming with a set of patients for us. Like nobody wants to see
Patient
us.
base is
That
very
is very
important.
important.
Yeah.
So we are beginners, like in that moment, in that particular time. So we have to concessions. Don't expect to when you come only they will come and 10,000
Yes.
dirhams they will offer
You
you
have
and
to
take it.
go through that phase
That
where you might be paid a little lower salaries, or you might be asked to go work in different clinics.
True.
All that will be there. That phase is there.
I
Yeah.
agree. People exploit such situations. There are clinics where not run by doctors, as well as some people doesn't have any idea what they're doing in
Yes.
dentistry. So they put very cheap prices and get all these doctors and make them work for a lower salary and all this.
Correct.
There are things going on in Dubai like that. Honestly speaking, I know because I'm in the market. So
Market, yeah.
see, these all are in the scene.
See, I think it is our luck plus the way we able to choose which is the best and get experience as a fresher. We have all this done, then I think we can come into a place which is better, right?
Yes, true. Even though I had friends who was working here, even they couldn't help me in the initial times.
Exactly.
Like nobody can. They can put a good word. Like my friend has come. Can you see? Consider. But first of all, we should understand. Like in order to work somewhere, you need an opening.
Yeah.
So Dubai community is a very small community.
Exactly.
You have n number of clinics. See, now the number of clinics have increased a lot. When I came 2014 time and all, number of clinics was very less.
Very less.
So if there is any opening, 100 people will apply for the same opening. And what I believe still is that if your CV is on the table, front of the HR man, right time, in the right place, you get a job.
It's very true.
And
very
you
true.
should go for an interview and sit with them and you have to talk. Some people, what I see is they when they go for an interview, they will ask, what about my health insurance? What is my this
They
thing?
start demanding.
They ask like without. So first of all, they if these all things you can ask after 2 years. Like if you are in a
Correct.
corporate setup, they may give you everything. But again, when you go for the interview, only if you demand initially, like I want this, I want that, and all,
They
then,
will not
Yeah, then
consider,
the
yeah.
person who hires, they will think that, oh, this guy started asking so many questions now only. Maybe he will be a problem or she will
Correct.
be a problem. So
Very
this
true.
I am telling you because I run a practice when people
When
come
you
for-
interview doctors,
Exactly.
you see that, right? That
It is
trend.
not that I don't like asking about health insurance or anything. Obviously,
Correct.
according to the UAE labor
We
law,
are supposed
we are
to,
supposed
yeah.
to give. So when you ask in the initial time, when you go and ask and try to grab kind of things,
Yes.
that doesn't
Give a good impression to the
definitely
hirers.
you can ask for, I need a fixed salary for at least this much because I have to survive in Dubai.
Because that's
And
a
then
genuine reason.
I will make revenue and you can give me cuts.
Mm.
So, or if they are offering in such a way that a base salary for us to survive as a beginner, and for if you perform well, you get good amount like this thing.
Understood.
We also have to work for the clinic. And we have to prove ourselves. So that is the what I told you initially. When you are practicing or when you have to show your for that you need good experience. You should know wide knowledge. Like if you are coming as a GP dentist, you should be good in doing your root canals. Get trained. Go to some places, invest some money, get training from proper some people who runs very good courses back in Kerala, I see, and many parts of India. So train in something, be good in something. So when you showcase something, like it is not about trial and error. Dubai community, there is no space for errors.
Correct.
So you can't.
And it is very dangerous also to make errors. The impact is going to be
Yes. So if somebody lodges a complaint and all, you will lose your license.
license.
So that is my honest opinion to the newcomers. Get trained first.
Correct.
When once I finished my course, I did from AJ Institute of
AJ
Dental
Institute,
Sciences, Mangalore. So our college professor, he had a institute kind of thing, and he was giving training for root canal treatment and crown preparation and all this. So me and couple of my friends joined for that. The training you get from our university or the or the college is very limited.
Okay.
There's like for a logbook like 20-30 cases. We do that is not really enough. Yeah. So my dad tells every time, so it is good that I spend some money for you for the training. Like, I think that time it was like 25,000 or something for the course. It was a big amount back then.
Correct.
But still, he likes all this.
Pushing to study, yeah.
So whenever I tell like to study, he
I mean,
used to give money.
That is
But,
evident because otherwise it's not easy at such a young age to establish and bring your own clinic in such a place like Dubai. So I think you would have got good support from your parents and everybody around.
How we are at home, that is how our this thing goes outside.
Correct.
So when they give some advice, take it. So
Correct.
you may feel a little why they are telling like this and all
At
at
that
this
point,
point.
yeah.
But in the future, yes.
That all of us has realized as adults. I'm like, what they told then made so much of sense right now.
Exactly.
Yeah.
When you go, you will understand. So it's about maturity also. When you get out of college as a new fresher, so try to be with some doctor, get some experience. So you can see you after 10 years or 15 years or 20 years, how you will be. And you should have that fire to work. Right? You should have that fire to practice.
That passion
learn new
towards your
things.
profession.
Exactly.
That is one thing that I have always thought about when you choose this profession, be it a dental doctor, be it an MBBS doctor, be it any profession. Why are you choosing it? I mean, like, why are you choosing it, and what is your end goal? Are you going to be happy doing this for your entire life? That is the question that I always wanted everybody to ask themselves before they take up this course. And after you get into this profession and you realize this is life, this is how your entire life is going to be, then you start questioning, oh my God, is this what I exactly wanted? That many of the doctors have gone through that phase, I believe.
True.
Because you're not able to balance family life, you're not able to balance your passion. So as doctor, I have gone through that phase where I used to think, because I like doing a lot of things, so I used to think, can I do that, can I do this, will I be inside a box? But then I realized that it's about the art of balance and having liking to all this. If you don't have a liking to one of it, you can't do it. That's very true.
What I like about Ajila is that you are like, as you told, you come out of the box.
Yes.
And you try to this thing and spread some knowledge.
Yeah.
To your fellow juniors. And
yeah.
So not everybody is trying to do that.
So now coming to the one of the question, most of the dentists are paid very low salary in India. I mean, like the pay scale, you know, right?
Yeah.
Which is very terrible. And why is this happening?
Unfortunately, now the number of clinics are really more in even in India and in Dubai also. The number of clinics are really more. But now, if you see, awareness has increased a lot. If you see like 15-20 years back, if you see a granny, there won't be a single teeth in her mouth. I used to remember when my grandmother, we used to crush chips and all, put in a grinder, grind it and give. You see right now, in this generation, the grannies which you see, not the Gen Z generation, the previous
yeah.
one, you see they will have couple of root canals, some bridges, restored. There's no situation that nobody has no teeth. And
yes, correct.
So you see, you can understand like what is happening now. So
everybody is taking the
exactly.
treatments and every procedure.
Exactly. So I see in a positive way. The more clinics are coming, it is good. People are more aware.
Correct.
So the number of people who's coming to get treatment will be also more.
The supply and demand both are high.
Yeah, that is so.
Correct.
The problem what happens now is that it is kindly a bit of underpaid. I recently came to know that for a filling in Kerala, they are charging like 1,500 rupees. For a cleaning, they charge 1,500 rupees. I'm talking about Kollam. I don't know about other places. But I see it's not bad. Come on, when I was
But at the same time, the doctors are paid like maybe few thousands extra than that. Like there is a huge gap, right? So as young dental doctors who pass out, that might be a huge, disadvantage for them, and they sometimes question their career choices. So
I just wanted to tell them patience.
Patience.
Yes.
Yeah.
Patience and patience will come. So
if you have patience, you will get patience.
So to start a practice, I don't think it will be too expensive. When you go for an MBBS, the price you're giving for studying is comparatively much more
Very
than
high.
a BDS doctor who passes out.
Correct.
But the same amount you have to save for starting your own practice
Correct.
at some point. But I don't suggest going and immediately opening a practice. Get enough knowledge. Even I have not opened a practice after my college. I've learned.
You worked under
Yeah.
somebody, then
And
you opened
then-
your clinic
yes,
in India,
exactly.
then you came here, worked
It's a
here, then
step-by-step
you started
process.
your clinic here.
Yeah.
So that's the whole journey.
I get still calls from some relatives and friends, mutual friends who was just passed and all. They wanted to work.
Yeah.
But I
Yeah.
told, like, see, for practicing in Dubai, first you have to have 2 years experience. Plus 1 year internship is considered. So
Yes.
3 years later, you will have to apply for the licensing. You have to go to the DHA site and you can do it by yourself. It's pretty easy to go for it.
Yeah, the DHA licensing exam to clear is also quite
Pretty easy
easier
compared to you know better.
Yeah, and I keep telling that also.
Yeah.
Compared to the NEET PG or anything, the DHA licensing exam is easier. But what are their options after they finish their graduation? So what do you
Dubai,
suggest? Not just Dubai, in general.
See, Dubai is a launch pad for all this. Like, you get openings from all this. Like, you can settle here, then plan for going somewhere. Any country you go, you have to give exam. I know.
That is the most
you know very
difficult
well.
part for doctors. You want to move to some country, start studying.
Yeah, don't expect like once you finish your college after UG, it's a dead end. No, you have to keep studying. You have to keep studying until you die.
Yeah.
The thing is, like, for something which we are using for a long time, one fine day people will tell that the pioneers will tell that this is no longer working. So
Yeah.
you have to make. So we have to keep training. So training is very important. That in India also they do CMEs. Here also they do CME. So always get trained from the experts.
Correct.
So studying after UG, if possible, finish your PG by the time. But I agree, not everybody cannot afford to go for a PG at that time. Again, spending so much money, people will think that I'm tired of so much studying. I want to work for some time and all this. So my opinion, if possible, like if you're financially good or if you can spare another 3 more years, go and finish the post-graduation.
Okay.
Your problem is solved. Otherwise, like I couldn't because my dad didn't had business and all at that time. So I had to work. So then I moved to this thing. After all this, like 5-6 years later, I joined for an MSc Orthodontics program in Austria. Then I did from American Academy of Implant Dentistry. I did implantology, a 2 years program.
Okay.
Then I gave licensing exam in Dubai for my privilege for the implant. I cleared that.
I think after